It's Revolution Healthcare, the show that keeps you in the know about the ever-changing healthcare system. We all need answers to our many questions about health and the revolution in healthcare. Presented by Patient Advocate for You, making sure that your healthcare is coordinated properly. And now, here is Sharon Gauthier, taking your calls and sharing information. 1-888-574-2723. 1-888-574-2723.
Good morning, everybody. Well, it's a nice, bright, sunny morning with lots of, the races going on. My vice president, who lives down in Norwalk, wasn't able to get up here because he's stuck in a race. Not doing it, but the traffic with it. So welcome to Revolution Healthcare Radio. We're here with the stories no one else hears. And for you to get information and education on resources available to you and your family that help support and navigate a very complex healthcare system and life in general. I just want to explain every time we have our show a little bit about the reason why we chose revolution. The description of a revolution, or the identification of a revolution, is a fundamental change in power or organizational structures that takes place that creates a complete change or modification of an existing constitution, which I really feel is going on right now, and it will continue to go on for a very long time until we've looked at healthcare a little differently than we do now, which is really driven by money and not necessarily driven by care. Today, I'm very happy to have with us Nora Duncan. Good morning, Nora.
Good morning, Sharon.
So Nora, who I've known for a while, is the state director of AARP. So I, along with many others in the world, started getting notes and notification from AARP when I was 50. And I remember thinking, oh gosh, I'm there. I'm already getting notification.
Welcome.
I know. Welcome to the world of elderly. This year I'm getting notification of Medicare, so it's even a little scarier as I've gotten older. And AARP, which I'll have Nora explain a little bit more, but it's the nation's largest membership organization for people 50 and over. AARP is leading a revolution. I thought that was interesting to find that on their website, in the way people view and live life after 50. AARP is a nonprofit, nonpartisan membership organization for people age 50 and over. They're dedicated into enhancing quality of life of all as we age. They lead positive social change and deliver value to members through information, advocacy, and service. It almost sounds like our mission statement when I look at that. And I'm not sure that I ever really looked at the details of that, Nora. So I'm really glad to have you on the show today, and I know that you and I have spoken in other venues. I wanted you to discuss a little bit, and you've been the director since 2012.
Yeah, I'm just going on to about 3.5 years.
So you're fully vested. They pretty much have taken over your life.
Yeah, they have. See,
yeah.
Here I am on a Saturday.
Exactly. So dedication is there, and if you can tell us a little bit, I've spoken a little bit generally about AARP, but we have AARP in Connecticut, which a lot of people don't understand, that every state does have their own office in there.
Every state has a state office that is staffed, and actually that includes Puerto Rico and the Virgin Islands and Washington, D.C. as well. So each state has a state director like myself and a staff, and we all have teams of amazing volunteers that help us accomplish the mission that you just presented to the audience. The volunteers are key. You know, there's 7 of us total in the state office, and we have nearly 601,000 members of AARP in Connecticut and about 38 million nationwide. And we are in communities across the state every day. Right now, we are in Ansonia and Hartford, and I'm going to mess this up, but I think New Britain. Live right now as I'm here with you. So that kind of thing happens every day, and my staff and my volunteers are key in making that happen.
Now, most of us join AARP, which I did many years ago, because you figure you get a discount. It's the reason why people join. You might get a discount if you're an AARP member on your flights, on restaurants or whatever. And I think initially people join for that purpose, not really looking into some of the really in-depth issues and missions of AARP.
So I think you are absolutely right, and our research shows that that's why people come in the door. My job in Connecticut is to make sure that people recognize that we're doing much, much more than that. So you're giving me an opportunity right now to talk about that. So for instance, in Ansonia, we're having a brunch with free mimosas for members and non-members alike. You know, the members get invited, but I put this stuff out on social media. You don't even have to be over 50 to attend. And this specific brunch, we did 3 of them in a row, and there's actually one coming up, I think, in Danbury next Saturday. So aarp.org/CT. You can find all of our info. But that's about the financial future for folks, about what we're doing in terms of policy to help people save for their future, because Social Security isn't enough, and 52% of folks aren't going to have enough. When we look at the millennials, when we look at Gen Xers in particular, will not have enough to sustain themselves in retirement. So that's what that's about. And then we're at the NBC Health and Wellness Festival talking about caregivers and all the work we're doing for caregivers, the unpaid family caregiver in Connecticut. And that's what a lot of our resources, our advocacy, our volunteers, our programs are about.
And our whole purpose for being here is to educate people and make them understand that there's a lot more out there to help them than not. And when we come back from our sponsorship moment, I want to talk a little bit about, on a national level, I was very aware of what went on with the class action suit regarding admissions and people not being admitted. So we can talk more about that, because, as you know, a few years back, people were put in observation in the hospitals. It was creating a huge problem. Well, my son tells me not to use huge, but it creates a big problem for the families, because they actually think they're admitted at the hospital, and they weren't. So 4 to 5 days out, families would be faced with a physician saying, well, they're ready to be discharged, but they were never admitted. They were under observation, and families are totally ambushed by that, not understanding that now if they need to go to rehab, then that meant that they had to privately pay for that, which is anywhere from $350 to $400 a day, which is a lot of money. So when we come back, we'll talk to Nora Duncan about more of the national level and then the state level.
For over a decade, Home Helpers has been making life easier for those in need.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Uh-oh, flu season again. Time to get a flu shot. You now have a choice in flu vaccines. You can ask for Flu Block. It's made with modern technology, while other flu vaccines use processes that date back to the 1950s. No actual flu virus is used to make Flu Block. Flu Block protects against the flu. The next time you get a flu shot, ask for Flu Block, the pure choice, because you have a choice in flu vaccines.
And we're back here now with Nora Duncan. So Nora Duncan is here from the state AARP. She's the state director. She's been with them since 2012. So she was speaking a little bit about what AARP does nationally. And before we left for our sponsorship message, we were talking a little bit about observation status and inpatient status. So from my perspective, one of the things that I found out a few years ago was that there was a problem with observation status within hospitals. So patients would go in, families would bring them in, the hospital would admit them, so the families would think. There should have been a discussion with families stating what the difference was between observation and admission. And in defense of the hospitals, I believe they probably are right when they said that. But when people are in crisis, as you know, they don't always hear. We started getting a large amount of phone calls from families stating, my mom's been here for 5 days on the floor, and now they're telling us that she's not been admitted, she's under observation. And I started squeaking about that a little bit although getting a lot of defensive responses from hospitals saying that they weren't doing that. In fact, it was creating a problem. So if you can talk a little bit about AARP's involvement with that, because I was very impressed, and it was actually one of my aha moments of how AARP is really out there advocating for families and patients.
Yeah, so you're absolutely right about observation status. And one thing that we've been able to do here in Connecticut is require, as of about a year ago, that hospitals actually inform a patient, although it might be in a moment of crisis, so people don't really understand. And I've witnessed this personally. It's not that the hospitals aren't following the law, because they are.
Right.
It's more about that moment in time when you're signing something. Do you understand? So you now have to be told about observation status. Doesn't mean you totally understand what it means. But the federal law has not caught up and made the change that we hope will happen. Representative Courtney has a really great bill that we've been supportive of in trying to stop this practice of observation status. The hospitals, so you're right, you will think you're in a hospital overnight, so you must have been admitted to the hospital. You can be there for several days before a decision has to be made about admission, but it does not preclude the hospital from discharging you with a recommendation of going to a rehab facility. But if you have not been admitted, Medicare will not pick up the cost of that rehab facility.
Right, because the admission needs to be a 3-day stay.
Yeah, and so the Center for Medicare Advocacy, which happens to have its home base right here in Connecticut with its executive director, Judy Stein, has filed a number of lawsuits, and unfortunately none of them have gotten far enough to actually fix this practice. But families are facing $30,000, $40,000 bills, bankruptcy, essentially, for many, and or foregoing treatment. And so we've been trying to work with organizations like the Center for Medicare Advocacy, supporting Representative Courtney in that effort. It's not easy to get things done in Washington, D.C., as you know. AARP has done a couple of things to try to get past that bipartisan or partisan gridlock with some focus on developing a caucus of bipartisan representatives and senators who will come together on issues regarding the care for our senior populations. And we have something we call the ACT Caucus. And that's exactly what the point is we bring people together to talk about the stuff that we all face. You can't have a conversation with a member of Congress without them understanding what it is to care for an aging loved one. They've either done it themselves, they know someone who has, they anticipate it'll have to be done for them. You've either been a caregiver, you are a caregiver, or you're going to be a caregiver, or you're going to need care. So
I think national statistics came out recently that 40% in the U.S. are caregivers, and they're non-paid caregivers, which is a lot of money that would be spent if it was a paid caregiver. So those caregivers are family members, grandchildren, nieces, nephews, volunteers that come in. And they're all getting stressed out because someone today who is working full-time, who's now faced with having to care for their 80-year-old mother, because people are working longer, right? Because they have to. They can't afford to retire, a lot of them, are trying to put a Band-Aid on something. And then when we walk in, it's usually a big crisis when they finally realize that trying to be proactive would have been better, but they don't know what their options are.
Okay, so a couple of things that you said there could have me go on a 20-minute,
Well, before you do that, let me give our phone number out, because I'm sure there's lots of people out there faced with the same thing. Our phone number, and Christian is waiting for your call, is 888-574-2723. We have Nora Duncan here, who is the state director for AARP, that I'm sure you all belong to. How many members in Connecticut?
We have just about 601,000, I think, right
so the 601,000 people out there, give us a ring. We'd be happy to answer your questions. So go ahead, Nora.
Okay, so we talked about the readmission, or the observation status. So one thing to understand is that if you're admitted to a hospital and you're not on observation status, that if you are readmitted within 30 days after discharge, the hospitals get hit with a fine.
They get penalized.
Yeah, and that's all part of the Affordable Care Act, which is an effort to try to make sure people discharge healthier with better instructions, to create a more positive environment.
And I always felt, and people, didn't like me for this opinion, but I really felt that it was interesting that the observation status around the same time that Medicare came down on the hospitals and said, if someone gets readmitted with the same issue within 30 days, you're going to be penalized. So isn't it interesting that at that same time is when the observation status increased, and it just made me think, great, I had a woman who went to a hospital 4 times in 1 month under observation status. By the 5th time when the family called me, and she actually had a pretty serious condition after being there for 5 more days, I realized that this appeared to be, not that I am suggesting that they actually were trying to do this, but it appeared to me that this was a ploy for them not to be penalized, because now that person comes back, right, and they hadn't been admitted, so they don't get penalized for it.
So, what the rationale behind it is, I'm not sure. And the hospitals are following the law for the most part. I mean, the problem is the law,
correct,
not the hospitals. But
correct.
Despite what you just said, all but one of our acute care hospitals in Connecticut are going to be paying a Medicare reimbursement penalty in 2015, 2016 because of this exact readmission problem. So this was people who were admitted and readmitted back into the hospital for the same issue within 30 days. So the Hospital Association in Connecticut, CHA, was
huge lobbying,
as are we, and lobbying's not a dirty word. It really is, because we're advocates. But we actually partnered up with them this year to create the CARE Act. And the CARE Act has, we believe, one of the benefits is to help people discharge with their family caregiver in a more educated way, so that when people go home from the hospital, they have the information they need about some really sometimes complex medical tasks that untrained, non-medical family members have to perform. And our hope is that better trained, unpaid family caregivers who leave a hospital more educated about what has to be done when someone goes home can help prevent hospital readmissions. So taking a proactive approach to what is a really big problem for both hospitals and patients right now, which is readmission. It's a big problem financially. It's a big problem for stress. It's a big problem for a lot of things. So the Hospital Association, they're partnering with us. The CARE Act, which went into effect on October 1st.
Right.
So this is very new. People have new rights now as a result of our advocacy work. We were the 13th state in the nation to pass the CARE Act, and 18 states now have the CARE Act. In all AARPs around the country, all those state directors, volunteers, and staff I told you about are all working to pass the CARE Act so that we have uniformity across the country. And it does a few things. When you go into the hospital as a patient, you are given the question, do you have an unpaid family caregiver that you want to name for the record? Okay? It doesn't have to be the next of kin. It doesn't have to be the person who walked in with you. You get to choose who that is. And you might say, I have 5 family members and I don't want any of them to be my own paid family.
What if they have a paid caregiver?
They can choose to name whomever.
So it's a
they
caregiver,
choose,
general.
When we talk about caregiving in Connecticut, there are nearly 500,000 unpaid family caregivers in Connecticut delivering $5.9 billion worth of care uncompensated a year. So if they had to pay for that, it would be about $5.9 billion. Now, we don't care who the patient wants to name, but they have the right to name their caregiver. Our statistics are based on unpaid because it's the backbone of the healthcare system.
Correct.
Right? Without $5.9 billion worth of uncompensated care and 500,000 people, we would be falling apart at the seams
So
tomorrow.
now we're recognizing
We recognize
these
who
caregivers,
they are.
and now we're going to be mandated to have them be part of
You get to
being
choose.
educated.
You get to choose.
Excellent.
Now, at discharge, the hospital will now be required to inform within a reasonable time frame about when discharge is going to happen. Some hospitals are already doing this really well, okay? So this sounds like a common sense, why wouldn't this already happen? Some do it. Some weren't. So you get informed as the caregiver. So I might get a call, come get your mom or your dad or your neighbor or whoever it is. But at the same time, the key here is that when you have this discharge plan, right, and it says, we need to administer this vaccination, you need to change that wound, you need to make sure this new prescription is part of it, you need to make sure the person does this PT, whatever it says, you can say, stop, I'm the director of AARP, I'm not a nurse, I don't know how to do this, show me how. And they will be able to show either video or in-person live demonstration of how to do something. So even though you're still in this crisis stress mode, you can have that opportunity and go home and feel more educated. Now, over time, I'm really hoping for partnerships where we can deliver videos that make sense on the top areas that people leave the hospital with, having to understand about, that we can continue to come up with resources to help the family caregiver. But in the meantime, people go to aarp.org/CT or, iHeartCaregivers.org. We have so many things. Just Google AARP caregivers. I can give you a wallet card that tells you what your rights are under the CARE Act, so you might be really stressed out and forget.
I would like some of those.
I'll get you some of those
to our clients.
And I will say right now, we're sponsoring the NBC Connecticut Health and Wellness Festival. We're there all weekend in Hartford. I just heard the guy over on the other station talk about things to do this weekend. We've got 1 million of those CARE Act cards. We've got a caregiver resource guide. Anybody can download for free or get from us for free.
I actually had a gentleman at an assisted living community come to me with the CARE Act, very knowledgeable elderly gentleman who's caring for his wife who's wheelchair bound, and asking me to explain what the CARE Act meant, because what he thought it meant is that they were going to fund him to be able to help his wife that he was personally caring for, although they did have a caregiver. So I think that's great, and
he probably got an email from us telling him that the CARE Act was law now, and that the goal was to help these 500,000 caregivers who are worth $5.9 billion a year. And this isn't about money. This is about a bump in the road that many caregivers face on a complicated and complex journey of taking care of an aging and possibly health-failing loved one, and trying to just eliminate one bump in a road.
Well, in addition to that, it needs to expand out. So I think that's great that we bring them in. I'll tell you a little story that happened just this week that none of that happened. So it's still an educational process. But I think that it's great that they're doing that. When we come back, I want to be able to talk more about where does that information go, because most people leave the hospitals not just with the caregiver taking care of them, with a VNA that will help take care of them.
Some people, not actually most. I mean, a lot of people do, but most actually leave with just the person they walked in with, or nobody.
Well, that's a little concerning, because under Medicare, if you're in a hospital in crisis, because Medicare is crisis-driven, which we can talk a little bit about, and not really a proactive type of coverage for you. To me, anyone who goes in the hospital should leave with a referral to the VNA and visiting nurses group of some kind that will extend with them additional information and education. So I want to talk a little about that, but I also want to tell you a story that happened to me this week. And obviously this particular hospital didn't understand what the CARE Act was. But it also gives, I think, us an opportunity to start educating, because this was the first time that I had heard of this or actually saw it in print from this gentleman, and I thought, wow, he's actually not in an assisted living. He's in an independent setting with some help. So I think that now creates an opportunity for us to go in and actually explain this to the families in there and the residents themselves, because most of them are caring for their loved one. There's one gentleman that comes in with his wife on the walker, the sit-down walker, where she's sitting and he's facing her, and he pushes her in for dinner every single night and puts her at the table and helps her eat. I thought, what a great idea and a picture of love between these two people. So we're going to hear from our sponsors right now. We'll be back with Nora Duncan from AARP.
Flu Block. It's a breakthrough vaccine now available to protect against the spread of influenza. Protein Sciences Corporation in Meriden, Connecticut developed a revolutionary technology.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it, is that our population that our service tends to manage are elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the flu vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the flu block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
Researchers at Protein Sciences created a novel vaccine with no eggs, no live virus or preservatives, essentially pure and natural.
For over a decade, Home Helpers has been making life easier for those in need.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Welcome back, everyone, to Revolution Healthcare Radio. We're talking today with Nora Duncan, who is the State Director of AARP. So we were talking about caregivers and the cost of caregiving. I'm going to, and Nora and I were just speaking about the cost to the caregiver themselves. So you were stating that the average age of the caregiver is?
It's about an age 50-year-old woman in Connecticut. Nationally, it's about a 49-year-old woman. So this is the average caregiver. I mean, it can be a 90-year-old man or a 25-year-old woman, but the average is about a 50-year-old woman who's still working, right, oftentimes full-time, and who, in many cases, she's a sandwich generation. She has the older parent. It's almost usually a mother, and it's almost usually for about 5 years of care. And she's still got her kids, who are oftentimes, middle school, high school aged.
And working full-time.
And she's working full-time, and she's usually on average providing about 20 hours of unpaid family care to that older loved one. I'm not talking about the responsibilities to her children in that time frame. So you can add on another 20 hours there. So she's pretty stressed out.
Yeah.
She's needing help. She's needing some respite from this. She probably has neglected herself.
Yeah.
And she's probably facing some health consequences to the entire thing, with the stress levels.
And consequences at work, too.
And consequences at work. So many people, unfortunately, both spouses and family members, find that their workplace environment is not one that can help and be supportive of that kind of lifestyle. People lack workplace flexibility. People lack the time that it takes. I mean, and this isn't necessarily a criticism of how employers employ people, but we think there's a better way. And if anyone is forced to actually leave the workforce early, our statistics on this show, and this is from a MetLife Mature Market Institute study from 2011, but the lifetime income-related losses for family caregivers age 50 and up who leave the workforce to care for a parent are an average of about $324,000 for women and $283,000 for men. So that's, I've lost a salary. I've lost the benefits. So this may be a 401k contribution. I've lost my input to Social Security, which can reduce my benefit later. And I've lost all that interest that adds up over time. So $324,000 for that average 50-year-old woman who might have to leave the workforce to care for the loved one for 5 years.
It's a lot of money.
It's a lot, especially if she's going to live to be 80 or 90 years old. Getting back into the workforce at that age is incredibly complex and difficult. And there's a lot of things we're working on at AARP about that as well. But also, that loss will now have an impact on her ability to take care of herself as she ages. Her ability to live and have a retirement that she expected to have, or even half of the retirement she expected to have.
So let's say they stay in work and they have a pretty okay, flexible work environment, but they still have to take time off. So
Yeah.
they're impacting their vacation time, their sick time. They may be taking time that they're not paid. Is there any safety net for them to be able to take a short period of time off and still maintain their job? Because I believe the Family Care Act does cover some of that.
So the Family and Medical Leave Act does allow you to leave the workforce for a certain amount of time. Connecticut's pretty generous in our Family and Medical Leave Act in terms of the time you can take and keeping your job. We think that we can expand the definition of family. So I'll just, tell you, I'm an only child, I'm not married, and I have no children. Okay? So I am not someone that anyone, if my parents passed, there's nobody, unless I got married, who can actually take time off to care for me.
Right.
So that leaves me pretty up in the air. If I got a cancer diagnosis and my parents weren't able to take care of me and I needed someone at home, I'm pretty much up that creek you know about, right? And
but then you'd call us.
Yeah, but I mean, it would be nice.
Calling us would mean that you'd have to private pay for that. And that's the other problem.
And so I think we can expand the definition of family. We've expanded it in so much of what we do. It's sort of part of our culture here in Connecticut. You know, love whether it's adopting family members. Anything you can do here. We can expand that definition. But then also, we're working at AARP and other our neighbors in Rhode Island have done this. California has done this. Washington has done this. So is really on paid family medical leave insurance so that you can leave that job because you have the flexibility to do so, but you don't have to take that full loss of income. Because some people, even though they have the Family and Medical Leave Act to take the time, can't afford to, because unfortunately that mortgage still needs to be paid.
Right.
I talked about
not paid.
No, and I talked about those 15-year-old kids who live at home. Or how about the college kid? Do you want to have to say, I'm really sorry, but I can't contribute to your college education anymore if you were lucky enough to be able to in the first place because my mother is sick and I have to care for her. So
this will be an opportunity, kind of like disability insurance, to be able to pay for an insurance that will cover some of your salary, but you're really not out on disability.
No. So this is, so I was appointed by the governor a few years ago to be on a task force to study this. This task force reported to the General Assembly with recommendations for paid family leave this past legislative session. As many bills do, the bill died. And so what we got out of that instead is Public Act 15.5, a section of that, which sets up a pretty significant study and a lot of requirements on feasibility and the like for the labor commissioner in consultation with the state treasurer and the comptroller and the commissioner of administrative services to establish these procedures that would be necessary to do this. Now, in my thinking, in the task force thinking, probably in the thinking of the commissioners, this would be something that employees contribute to. So I'm going to make this up, so nobody quote me on this later. But let's say it's a penny of every $5 goes to a fund. And this fund becomes sort of like unemployment insurance, where when you face that crisis, you have the ability to draw in some wage replacement so that you can hopefully not have all the other things happen, like lose your home. The largest source of bankruptcy, the largest cause of bankruptcy over age 50 is actually a medical
issue.
And so we're not living in a society where we try to be preventive about a lot of these things.
Correct.
We have a population that is aging faster than it is, anything else. And we need to look at ways not to have this be crippling and bankrupting to families. Because you know what? If that 50-year-old woman can't leave work to take care of that family member, and she's one of those 500,000 people in Connecticut alone who are contributing $5.9 billion of uncompensated care to loved ones, if she can't do that, the family member isn't going away, right?
So someone's going to end up
So then we're going to put mom in a nursing home. We're going to let her spend down until she goes on Medicaid, and then guess who pays the bill?
We pay
the bill. Right. So proactive approaches that are family friendly and still employer friendly. And there are companies that do this already now as a benefit. That gives them a competitive edge that others don't have. I would love to live in a state where we said we're all doing this because it's the right thing to do.
Correct.
But that's not the case. And someone shouldn't have to choose between keeping mom out of a nursing home and their mortgage.
And even if they get ill themselves, it's not even for a family member.
Exactly.
My other question about that, though, is so when you are out for that period of time, let's say you're covered for your wages, what does it do to your benefit? Because as you know, you need to be actively working in order to have your health insurance be active without paying for it and still generate vacation time or sick time. So you may not know that now, but I think that should be part of the committees looking at, because I know as a state worker, my daughter works for the state of Connecticut, and when she was out ill for almost a month. She was able to activate family leave, but what she was faced with is that she didn't have enough sick time to cover that, had to then ask for the sick bank, which she's still waiting for, even though she went back to work now. But because she was not actively employed after she used her time, she was then faced with having to pay for her own health insurance, which was an $800 bill, lost the ability to generate any vacation time or sick time during that. So now I'm seeing how that impacts her. I'm not sure whether it's just the state of Connecticut employee that happens to, or whether or not that happens to any employee and I think it does, that if you're not actively considered working, so that has to be a piece of it too.
And, I don't know all the details of how that works. I do actually believe that the state employee system is slightly different than the Family and Medical Leave Act itself. But again, I'm thinking of all those meetings I sat through and all that information, and it gets a little cloudy after a while. But you're right. These things all need to be considered. The Family and Medical Leave Act itself does have laws built into it. I mean, Connecticut's Family and Medical Leave Act is more expansive than the national standard. So I'm not 100% sure, but you're right. That is something that needs to be considered. And, maybe at that point, I would say, as someone who's been doing active advocacy for 20 years, you get the basics done and you go back and talk about the others.
Exactly.
I want this to be something that employers don't see as a problem.
Correct.
The workforce that has the flexibility for people to stay and work, you don't lose people to them having to leave. The cost of rehiring and training is immense. And so we're hoping that, we actually can find, and if you're out there and you're listening to this and you're an employer that thinks this kind of stuff actually is a good idea and you're doing it now yourself and give us
a
works
call.
for you, I mean, I'd love to hear from you at any time.
And how would they contact you?
You can reach me. I always end up giving out my personal phone number because I can never remember what our 1-800 number is. So you can reach me at the state office directly at 860-548-3161. AARP's website for Connecticut, where you can find all of our information about our events. And by the way, we do some fun events.
Yeah.
So we're talking about serious stuff here, but I got people in Ansonia right now drinking mimosas.
Exactly.
For free.
We're sitting here drinking our coffee.
And they're not just members, they're non-members too.
Right.
So, and these are things that we provide for free because we believe that, my theory is sugar medicine.
Yeah.
We need to talk about the serious stuff, but life doesn't have to be so serious. You can do it in an environment that actually makes you comfortable and happy and makes you want to come back and learn more important things. I have a whole toolbox of things that people can use to help them. They might not want all of them, but I'd love for them to know what it is. So that's aarp.org/CT. Find the Connecticut office.
Oops, I did that. My apologies. Christian's rolling his eyes at me. I think that we're not understanding what AARP does. For me, like I said, when I was 50 and started getting info, I thought, this is great. I'll have a membership. I'll be able to get a discount on my cars.
And we have fun stuff that we sign for local discounts with nonprofit organizations.
Right. So
I'd love to talk about some of those.
As I am getting older and realizing the advocacy that they do, that's going to benefit me. For instance, the observation versus inpatient status. And also realizing that everyone's working together. I'm a firm believer that no entity in itself can work by itself, and that if we all start looking at what each other can provide for each other and working together, that is what's going to make things work. We're now talking to Nora Duncan. She's the state director for AARP in Connecticut. We're talking a lot about the Connecticut chapter, the issues that are being addressed, future concerns, and what some of those big issues are that we're addressing. Caregivers are a huge part of this, that there are, how many caregivers did you say?
We have nearly 500,000 family caregivers in Connecticut alone.
It's 500,000 caregivers in Connecticut that aren't paid. Those are the people that are in the workforce, having to take time off, that are stressed out, not taking care of themselves. It's going to impact all of us. regardless of whether we ignore it or we really talk more about how we support those caregivers, because if we don't support them, they will come into the system, which costs the system a lot of money. We also talked about the Caregiver Act, which provides information and education for whoever that caregiver is, which is identified by the patient when they come in. Still a process going on, I think, because I did have an incident this week, which when we come back we'll talk about, that didn't happen with. So my knowing this, I'll be able to help with the education process.
Yeah, we're only 18 days into the law, so we have a lot of educating to do, which is why I'm so glad you gave me the opportunity to be here today.
Well, this 90-year-old that came to me at this independent setting the other day,
his info.
He had like this caregiver law, right in hand. He goes, talk to me about this. I want to know what this means. So we sat down and talked about it. So we're going to hear a little bit from our sponsors right now. And please come back and call us at 888-574-2723. We'd love to hear from you. I was very impressed when we first met, and what I was impressed with home helpers is their passion for what they're doing. So why don't you tell me a little bit about the reasons why you actually got into this?
For me, it's personal. I took care of my aging parents who wanted to stay at home. Home helpers share that same vision. We picked home helpers because they're extremely strict about the quality of care, the training of the caregivers. They're very serious about putting someone in the home and making sure they're insured, bonded, and well qualified to take care of someone's loved one.
Are you looking for senior care for an aging parent or loved one? Let Home Helpers of Connecticut make your life easy. Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
You now have a choice in flu vaccines. You can ask for Flublock. No actual flu virus is used to make Flublock. No gluten, no latex, no eggs, no antibiotics, or no formaldehyde. Flublock is proven to provide broad protection against multiple strains of the flu. The next time you get a flu shot, ask for Flublock, the pure choice, because you have a choice in flu vaccines.
Welcome back, everybody. We're here talking to Nora Duncan, State Director of AARP. Our number is 888-574-2723. Before I forget about telling the story this week where the CARE Act, didn't work, they may not have known about it, is I actually have a 50-year-old gentleman who had an amputation of his toes due to some diabetes. He was discharged from a convalescent home, went into an independent setting with some help temporarily before he went home. He's going to plan to stay there for 90 days. He was home like a day and went into the hospital with a urinary tract infection and ended up in the ICU. So the day after he went in, I went in, introduced myself, brought my HIPAA release form. The nurse and I spoke to him together. It was very clear that I was involved with his transition back. And he then transitioned out on that Monday to a medical floor, which no one called about, but I called to find out how he was doing and was transferred to the medical floor. At that point, I spoke to the nurse at the unit who had my HIPAA release form, knew something about me. I also talked to her about his needs, which one was he had an implanted port that needed to come out, which we had talked about before, and to let me know when he would be transitioned back, that I would help with making sure that his VNA that he had was reinitiated. I wanted to talk to the discharge planner, get his aids back in place for him, and greet him when he got back there. So that was on a Monday. The nurse gave me the number of the discharge planner who I called and left a message for. Never heard back from her. Tuesday, went in to visit him. How are you doing? He was feeling great. Totally with the program. I mean, this isn't anyone who has any dementia of any kind. He's young. He's just had diabetes for a long time. So really didn't spend a lot of time there trying to annoy them because I didn't want them to think that I did not trust that they were going to put this together. So Thursday came around. I get a call that morning about 9:30 from the discharge planner who said, I'm calling you to initiate services back. He's going back. And I said, well, I'm not quite sure what you mean by initiate services. Well, they thought I was the VNA. So I went on to explain what we did and told her what VNA he used, and she had no idea. I also said, asked her whether or not he had this implanted port taken out. Had no idea that he had one. I also asked her if he was confirmed for what time he was confirmed to leave, because I wanted to make sure that the wound vac that was in his apartment would be transitioned on his wound. Had no idea he had a wound vac or that he even had a wound. And this was a nurse. She then said, well, maybe he needs to be referred to the wound clinic. And I said, well, he actually goes to the wound clinic every week at your hospital. So I unintentionally or intentionally annoyed her by my displeasure in not being knowledgeable or even speaking to this guy who's 50.
Or maybe reading the chart.
Exactly. So she then said, well, I'm going to have the manager call you. Well, that's great. I mean, I don't find that as a threat. I'm thrilled to kind of speak to someone on the way up. The manager called me, and I just said to her, look, I'm very disappointed. I was there 3 times. It's very clear that staff knew who I was. I left a phone call for the discharge planner with all the information she didn't have in front of her. And I'm now being called at 9:30, like I'm the VNA, not even knowing what his VNA is, for him to be discharged home. And although he's totally with the program, he did just get out of the ICU. He did just have surgery in your hospital, by the way, 6 weeks ago. And you're now discharging him out, and no one has any idea. So I'm a little annoyed. So she said, what do you want me to do? And I told her, I said, I want you to call and schedule for him to get the port out. And I want you to call to confirm that his wound clinic appointment is intact for this week, because he goes every Thursday. Then I want you to call to make sure that the VNA is set up and that there's going to be someone there to put the wound back on him. And the other thing I'd like you to do is go in and talk to him. The man is 50 years old. He's not one of our clients who's 90, in which case I would be there every day, or one of our nurses. He's 50. It's obvious that no one had a conversation with him. So I guess this is a hospital that doesn't know about the CARE Act yet.
Actually, the CARE Act doesn't do anything to address internal care coordination. So what it sounds like you're talking about is something I've faced personally in my life, which is, you know, sometimes all the pieces of the machine aren't working in sync.
Correct.
So you've got a whole nother bag of problems right there. But that's the internal care system, the internal care coordination that sounds like somebody's not, you know, I'm not sure if the care coordination is not, all things are not created equal when it comes to different hospital systems. And this doesn't do anything to address that. So the CARE Act addresses, somebody should have been talking to it does 3 very simple things. And I'm not saying they're sufficient to cure all the ills.
But I was identified
as the caregiver.
As the caregiver.
So that means that step 1 of the law was followed. Step 2 is you were called for discharge. Doesn't mean discharge is working the right way.
So they can just call and say they're ready for discharge.
Well, what we're supposed to do is there's a reasonable time frame in which you're informed. So the law only would cover, I'm going to make up an example. It's 9:30 and you get the call. Discharge is going to be at noon. Letting you know, come on down. And then talking through that discharge plan for you. Now, here's where someone who's educated like you are about the system would say this discharge plan is kind of a mess because you don't know where, he has a wound care clinic.
Correct.
So you would be able to say, stop, talk to me more. Most people who are the unpaid, unexperienced, I'm a husband or a wife or a daughter or a son, or I don't know anything about the care system, would be able to say, okay, so we've just had surgery, and they say you need to clean this wound, and this is how you bandage it, and you can say, whoa. What'd you just say? How do I do that? Now show me how to do that. That's all the CARE Act does. 3 simple things. All the other things you're talking about are systematic problems that
will continue to exist.
There's a way to address.
Again, so they can virtually make a call and say they're going home, this is what you need to do. And if you say, I don't know how to do it, then they say you need to come in at that time.
They say, I don't know how to do that, show me. Then they'll have to provide to you either in person or on video an example of how to do it. And like I said, we're only 18 days. I think it's the 18th.
But this is a great start.
It's a good start.
But I can tell you that it's going to be equally as a mess as this was, because if, in fact, they don't take the time, and they don't have the time, very seldom do I walk into a hospital where there is one dedicated case manager on a unit.
And yes, and you're absolutely right. So the theory with the CARE Act is that there was not one state in the union that had anything like this on the books.
Right.
Right? So there was previously no requirement.
Right.
That
And now
you be
there
told
is.
anything. And now there is. So let's let that settle in. Let's get people
And see
educated.
what happens with it.
And then as people become more educated, we expect that the system has to start to respond to educated consumers and patients.
Great.
And you know what? We have an opportunity to do more after we see how this works.
Right.
But let's right now set a low bar
Right.
and see where we end up.
Minimum.
And that's how advocacy oftentimes works. I mean, we don't run in and say the entire hospital system has to change, because I'd never get that bill passed.
Correct.
So you start...
And nor is there enough time right now.
Yeah, and the hospitals have their own things they need to do and to fight, and to get the hospitals to collaborate with us to say, you know what, this actually probably would be good for patients and for us, is a big step. And I want to make sure they have credit for that. But the reason they know it's a big step is because they have a lot of problems with readmissions.
Right.
And if this can help reduce readmissions, so
then they're going to be part
then
of
this
that.
is going to be a good thing for us. But it's half of a baby step.
Well, and I'm really happy that, and again, AARP was behind this, which people need to know. And I'm really happy that we're starting somewhere, because they've always been left out of the loop, not intentionally. Listen, I was a care manager in the hospital. You were like,
you just want to get that person out of the hospital and get the next one in.
I get the pressures that they have. But at the same time, I was also the nurse and would get in trouble for it, because my length of stay was lengthy in asking those questions that nobody wanted to ask 10 years ago that they're now mandated to ask. So we've come a long way. I see huge positive changes that have happened in the hospital systems, but we still have a lot of problems. When we come back, I'm going to have Nora take the rest of our time to talk about the benefits of belonging to AARP.
Yeah, and what we can do for folks.
And what we can do for folks, and especially in our state, to be able to support businesses, to get discounts, which I think is very important. And it's obvious to me we have to have you come back. I also wanted to speak to you about the gentleman that you said that we should entertain speaking to, because there is community care,
community first choice. There's a lot of things, and I have staff who have a lot of in-depth policy knowledge that I let them have all that in-depth policy knowledge. As I said, I'm at Jackie of all trades.
We're not ignoring a lot of what's going on. There's a lot going on behind the scenes. I'm usually down at the legislative building during the time that they're there, looking at policy, reading testimony, discussing things with people, and we have a lot of people out there supporting us. So you are listening to Revolution Healthcare Radio, and we have Nora Duncan, who is our guest today, and you can call us at 888-574-2723.
Are you looking for senior care for an aging parent or loved one? Are you a new mom or working parent who could use an extra hand? Let Home Helpers of Connecticut make your life easy.
What I was impressed with Home Helpers is their passion for what they're doing. We worked with them in the past, and we recommend them to our clients.
For over a decade, Home Helpers has been making life easier for those in need.
Get a free consultation that is tailored just for you. Call 860-698-2244 or find the nearest office at homehelpershomecare.com.
Flu Block. It's a breakthrough vaccine now available to protect against the spread of influenza. Protein Sciences Corporation in Meriden, Connecticut developed a revolutionary technology.
It is the healthy individuals that carry and spread the flu. Every year, about 30,000 Americans will die as a result of the complications of influenza.
It's one of the reasons why I had an interest in it is that our population that our service tends to manage are elderly. People were having to get a booster with the flu vaccine. What I liked about Flu Block is that the people last year in our group, the clients of ours that got the Flu Block vaccine, did not get a booster, and they did not get the flu. And the people that didn't get the Flu Block vaccine either got the flu in addition to getting the vaccine, or were told by their physicians that now we had to try to create a process for them to get a second vaccine.
Researchers at Protein Sciences created a novel vaccine with no eggs, no live virus or preservatives, essentially pure and natural.
Welcome back, everyone. You're listening to Revolution Healthcare Radio, where we have Nora Duncan here today, the State Director of AARP. We're going to use the last few minutes of our segment here for Nora to tell us about the benefits of belonging.
So There's benefits the way you're thinking of them in terms of the stuff you mentioned, right?
Correct.
Like there comes with an AARP membership, lots of our national partners who offer discounts, that can be dining, travel, insurance, and the like. But locally at the state level, what my job is to connect Connecticut consumers to the fun that they can have in Connecticut with our nonprofits, support our nonprofit community, allow families to take advantage of discounts right here at home. So I'll just mention a few of those to show the diversity of what we have to offer. We have great nonprofit partners. So for instance, the Science Center, the Hartford Stage, Mystic Aquarium, the Beardsley Zoo. Oftentimes we work individually with the Bushnell on shows. They're a little different because you have to negotiate each one. We've had many great advance sales and tickets for that are at a discount. So members of AARP and their guests can get a quick advance over everybody else. Get the discount, but get a better seat.
Right.
We even have a tuition discount for AARP members. And this is one of the few that's really exclusive to AARP members and not their guests. And that's at Albertus Magnus College that has a fantastic program for older adults that can help them get back into education, into the workforce, change their entire career
And that's
path.
age 50 and up.
Yeah. And, membership is under $20 and includes a spouse if you're married. And so you use one of these things once and it's paid for itself, but it's also brought you and your family out to take the best advantage you can of our local community. And so there's a full list of them. You can just check it out. We have local discounts. You can call us. You can go to our website, aarp.org/CT. But then, we also have a bunch of things that we can bring to communities. So you might say, Nora, I heard that you guys have a program about fighting frauds and scams, and it's called the AARP Fraud Watch Network. I have a church group that might be really interested in that. I have a civic organization. I'm a library. I want to set up a series. We take invitations. That's half of how we are in those towns that I just, that I mentioned. It's not all about me creating something.
Right.
That I have this big party with mimosas and we talk about the financial future and how working and saving is affecting Connecticut residents. We get invited in and we present all of this for free. And my volunteers, if you're looking for a way to volunteer and bring meaning to yourself, have a good time, get really good training, get mileage reimbursement, all these things. I have people out doing things all the time, from preventing frauds and scams to something we call Life Reimagined, where you take a look at your past, your present, and where you want to be in the future, and you really explore your real possibilities.
Nora, thank you so much. We're going to have you back. We had Nora Duncan today with Revolution Healthcare Radio. She is the state director of AARP. Next week, we do not have a guest, and we are going to be speaking about a lot of controversial issues regarding healthcare, a lot of stories that I'm going to talk about. So please listen in next week from 11 a.m. to 12 p.m. And thank you for listening today.
Thank you, Sharon.